Right now, take off one sock, just one. Look at the skin where the elastic sat all day. If you can see a clear indentation pressed into your calf, a groove that stays there for 30 seconds, a minute, sometimes 5 minutes before the skin finally smooths back out, keep watching. Because what you're looking at is not a sock problem, it's not a salt problem. And despite what 70% of people over 60 have been told at a doctor's appointment, it's not a heart problem either. It's a drainage problem. And the system responsible is the one nobody in a medical office ever bothered to sit down and explain to you. The water is already in your leg right now. Maybe half a liter. Maybe a full liter sitting quietly in the tissues around your ankle and calf while you've been sitting today. And tonight, when you lie down, that water is going to do something to your body that ruins your sleep, stresses your heart, and makes every other problem you're trying to manage significantly worse. I'm going to show you exactly what's happening inside that ankle, the 2 30-second tests you can do right now to know if this is your problem, and the 5-minute habit that drains the reservoir before bed so it doesn't wake you up at 2 in the morning. I'm Dr. Hartmann. Subscribe and leave a like right now because what I'm about to walk you through will not come up at your next appointment. There's no billing code for explaining the lymphatic system. The system profits when you get an echocardiogram, when you fill a prescription for a diuretic, when you come back confused 6 months later because nothing worked. Nobody makes money when you understand how your body actually drains fluid. You know the moment I'm talking about. You come home, you peel off your shoes, and there they are, the ankles that look thicker than they did this morning, the calves that feel tight and heavy, the rings on your fingers that suddenly refuse to come off. You press your thumb into the skin above your ankle bone and watch it leave a little white crater that takes forever to fill back in. You stand up from the couch after sitting for an hour and your legs feel like someone poured concrete into them while you weren't looking. And when you mention this at a doctor's appointment, what happens? You get asked about your heart. You get told to cut salt. You get handed a prescription for a diuretic, a water pill that makes you run to the bathroom all day. And for some people that helps a little. For most people over 60, it does almost nothing because the water was never in your bloodstream in the first place. The water was in the tissues. And a diuretic can't reach tissues. It can only pull water out of blood. So you've been treating the wrong compartment. Let me fix that. Your body has 2 drainage networks, not 1, 2. Most people only know about the first one, blood. Arteries carrying fresh blood out, veins carrying used blood back. That system has a pump, your heart. It runs automatically every second of your life, whether you help it or not. The second network is called the lymphatic system, and here's what nobody sat you down and explained. It has no pump, none, 0. Your lymph is a clear, pale yellow fluid that constantly leaks out of the tiny blood vessels in your tissues. It bathes your cells, it picks up cellular waste, dead bacteria, excess protein, and excess water. Then it has to be returned to the bloodstream through a completely separate set of vessels called lymph capillaries and lymph ducts. 2 liters of it every single day, but those lymph vessels have no heart attached. They move only when you move. Think of your lymph system as a conveyor belt that only runs when you put weight on it. Every step you take, every calf muscle contraction, every ankle flex squeezes the lymph vessels and pushes the fluid upward. Stop moving, stop draining, sit for 3 hours and the belt stops entirely. The fluid just sits in your ankles doing nothing. Now, when you're 30 years old, this is not a serious problem. The lymph vessels are elastic. The valves inside them are tight and crisp. A single walk across the parking lot restarts the whole system within minutes. But after 60, 3 things change at once. The lymph vessels stiffen, the valves begin to leak, and the tissue around the ankles, the loose connective matrix that holds everything in place, starts to lose its own elasticity. So fluid seeps out faster and the system drains it slower. The math stops working, and the reservoir grows. Before I go any further, I need to pause and draw a clear line. There are situations where ankle swelling is not a lymph problem and is a genuine medical emergency. You need to recognize these. Stop this video and see a doctor today if any of the following apply to you. 1. One leg suddenly swells dramatically more than the other within a few hours, and it's painful, warm, and red. That can indicate a blood clot in the deep veins. It's dangerous. Get seen today. 2. Both legs swell and you're having trouble breathing, especially when you lie flat. You wake up gasping at night. You can't walk a flight of stairs without stopping. That pattern points to heart strain that has moved past the early stage, not something to manage at home. 3. Swelling combined with sudden weight gain, 4 or 5 pounds in a single week, and foamy urine. That combination suggests the kidneys are letting protein escape. That needs blood work this week, not next month. 4. Swelling only on one side, painless, hard to the touch, in someone with a history of cancer treatment in that region. That can indicate lymph node blockage that needs evaluation. If none of these describe you, if your swelling is gradual, symmetrical, worse by evening, better by morning, and you have no breathing trouble at rest, then what I'm about to walk you through is for you. There are essentially 3 patterns of chronic lower leg swelling after 60. They look similar to the eye and have completely different causes. Pattern 1 is venous. Your veins are struggling to return blood to the heart. Valves inside the veins have failed. Blood pools, pressure rises, water is forced out through the vessel walls. You'll usually see visible varicose veins, a brownish discoloration on the shin just above the ankle, and the swelling gets dramatically worse by the end of a day spent standing. Pattern 2 is lymphatic. This is the one we're focused on today. Lymph flow has slowed, the tissue is saturated. The swelling is soft, leaves a pit when you press it, feels puffy rather than tight, and often involves the top of the foot, the part that sits right behind the toes. When lymph swelling has been going on for years, the skin on the top of the foot becomes so thick you cannot pinch it between 2 fingers. That's a clinical sign called the Stemmer sign, and it points strongly at lymph, not veins. Pattern 3 is cardiac or renal. Your heart or kidneys are not managing fluid properly. The swelling is symmetric, gets worse through the day, and critically, it's accompanied by other symptoms. Shortness of breath, waking up multiple times to urinate, extreme fatigue, rapid weight gain. If you have those partners, you're in pattern 3, and it's not a home protocol. You need a workup. Most people over 60 with chronic evening ankle swelling and no other symptoms fall into pattern 2. Lymph. Let me tell you about someone I'll call Margaret. 68 years old. Lived in Greensboro her entire life. Retired school teacher. Walked into my office convinced her heart was failing. Her story went like this. For 2 years, her ankles had been thickening by evening. At first, just a little. Then enough that she could no longer wear the shoes she had always worn. She bought wider shoes. The swelling progressed. She mentioned it at a checkup. An echocardiogram was ordered. An ultrasound of the heart. The heart looked fine. Ejection fraction, the percentage of blood the heart pumps out with each beat, was 62%. Completely normal. But Margaret was still swelling. She was given a diuretic. She took it for 6 months. She ran to the bathroom constantly. The ankle swelling barely changed. She was exhausted, dehydrated, and still swollen. She finally said one thing that unlocked the whole picture. The weird thing is, when I travel and walk around all day, my ankles are actually better. That was the clue. Her swelling was better with movement. Her swelling was worse with sitting. Her heart was fine. Her kidneys were fine. Her veins on ultrasound showed only mild age-related changes. What Margaret had was a lymphatic drainage problem that no pill could fix because the fluid was not in her bloodstream. It was in her tissues. Here's what happens to Margaret's body every single day, and probably yours. She wakes up, ankles look thin, she's been lying flat for 8 hours. Gravity wasn't pulling fluid down into her legs, and her lymph system had all night to mostly clear the reservoir from yesterday. By morning, she's almost back to baseline. She gets up, has breakfast, sits down at the kitchen table for an hour, sits in the car for 20 minutes, sits at her volunteer desk for 3 hours, has lunch, sits again. By 2 in the afternoon, she's been vertical but mostly immobile for 7 hours. Fluid has been slowly leaking from her capillaries into the tissue of her lower legs the entire time. Her calf muscles have barely contracted. The lymph conveyor belt has barely moved. The fluid is just accumulating quietly, a teaspoon at a time, into a reservoir she can't see. By evening, the groove appears where her sock sat. By 9, the ring on her finger is tight. By 10, she lies down. And now the real problem begins. All that accumulated fluid in her ankles, now that gravity is no longer pulling it down, begins to slowly reabsorb into her bloodstream. Her heart receives an unexpected flood. Her kidneys detect the extra volume and shift into overdrive producing urine. She wakes up at 2 in the morning, at 4, at 5. By 6, she's exhausted. The cycle begins again the next day. 2 tests right now, 30 seconds total. Test 1, the pit test. Find the bony ridge along the front of your shin about 4 inches above your ankle. Press your thumb in firmly. Hold for 15 seconds. Lift your thumb and look. If there's a visible indentation that takes 10 seconds or more to smooth out, you have what clinicians call pitting edema. Grade 1 is a slight dent. Grade 2 is a deeper dent lasting longer. Grade 3 is a deep dent lasting over a minute. Make a mental note of what grade you're at. You'll retest in 2 weeks after the protocol, and the change is measurable. Test 2, the foot skin pinch. Try to pinch the skin on the top of your foot just behind your second toe between your thumb and forefinger. If you can easily lift the skin into a fold, your lymph is moving. If you cannot lift the skin at all, it feels like it's fused to the foot beneath, you have a more advanced lymphatic saturation. This is called a positive stemmer sign, and it's one of the simplest clinical indicators of chronic lymph congestion that exists. 3 things that make lymph swelling worse. Most people over 60 do all 3 daily without realizing it. The first is hidden sodium, not the salt shaker. The hidden stuff: cheese, cured meats, canned soup, bread, condiments, restaurant food, frozen meals. Sodium pulls water out of your bloodstream and into your tissues. Your body will hold on to approximately 4 cups of water for every gram of excess sodium. Most Americans over 60 consume twice the sodium they think they do. The second is sitting after dinner. The hours between 7 and 10 at night, when you finally relax in the recliner, are the hours when your legs pull the most fluid. 3 hours of immobility after your largest meal of the day creates the worst possible conditions for overnight reabsorption. The third is alcohol. A single glass of wine in the evening dilates your capillaries, increases the leak rate from vessels into tissues, and suppresses the hormone your brain uses to tell your kidneys to slow down at night. 1 drink and your ankles will be noticeably worse by morning. Now, the other direction. Things that support lymph flow. Water. This is counterintuitive. Most people with swelling drink less water because they think more water means more swelling. The opposite is true. Dehydration thickens lymph, making it sluggish and harder to move. A well-hydrated body has thin, free-flowing lymph. Aim for roughly half your body weight in ounces, spread throughout the day, tapering after 5 in the afternoon. Foods high in natural flavonoids, compounds that strengthen the walls of small blood vessels and reduce leak. The best sources are dark berries, buckwheat, citrus peel, and red cabbage. A cup of berries a day has measurable effects on capillary integrity over about 8 weeks. Protein. This one surprises people. Low blood protein, specifically low albumin, is one of the silent drivers of tissue swelling in older adults. Albumin is a protein that holds water inside your blood vessels. When it's low, water leaks out into tissues and sits there. Many older adults are mildly protein deficient without knowing it. 2 servings of high-quality protein per day. Eggs, fish, chicken, lentils, cottage cheese. This directly improves the physics of fluid balance. Magnesium, deficient in most people over 60, involved in smooth muscle tone, including the walls of lymph vessels. Pumpkin seeds, dark leafy greens, and almonds are the easiest food sources. Now, the 5-minute habit that drains your ankles before bed. This is the core of the video. Pay attention. Every part matters. Morning. Before your feet hit the floor, while you're still lying in bed, do 30 ankle pumps. Point your toes down, then flex them back up toward your face. 30 times. This takes 45 seconds. It restarts lymph flow after 8 hours of stillness and prevents the fluid from rushing downward the moment you stand up. Daytime. Every hour you're sitting, do 20 calf pumps. Heels on the floor, pump the toes upward and back down. Or if you can stand, rise up onto the balls of your feet and drop back down 20 times. This takes 30 seconds. It keeps the conveyor belt moving throughout the day so fluid doesn't get a chance to accumulate. Set a timer if you have to. Before dinner, 5 minutes of slow walking, not a workout, just movement. Around the block, around the house, around the yard, walking activates the deep calf muscles in a way that seated ankle pumps cannot. Evening, 90 minutes before bed. This is the critical piece. Lie on the floor or on your bed. Place your legs straight up against the wall at roughly a 90-degree angle. Your heels higher than your hips higher than your heart. Stay there for 15 minutes. During those 15 minutes, do slow ankle circles, 10 in each direction. Then alternating ankle flexes, 20. Then, while still inverted, place both hands flat on your abdomen and breathe deeply through your nose, belly rising, for 3 minutes. Slow, deep belly breathing activates the thoracic duct, the main drainage vessel of your entire lymph system, which sits right behind your diaphragm. Every deep breath is literally pumping your lymph. After 15 minutes, slowly roll to your side, sit up, and do something unglamorous but effective. Starting at your ankle, use the flat of your fingers to stroke the skin upward toward your knee. Slow, gentle, always toward the heart, never downward. 10 strokes on each leg. This is a simplified version of what's called manual lymphatic drainage, and it physically moves fluid from the tissues into the lymph capillaries. Right after the sequence, you will feel the need to urinate. You'll release 300 to 400 milliliters of pale urine. That's the fluid that otherwise would have woken you at 2 in the morning. You just drained it while you were awake and in control. Margaret did this protocol for 3 weeks. By the end of week 1, her sock marks were gone by morning. By the end of week 2, she wasn't waking up at night. By the end of week 3, her ankles at 9 in the evening were the size they used to be at 9 in the morning. Her echocardiogram hadn't changed. Her prescriptions hadn't changed. What changed was that her lymph system was being given its work shift at a time that suited her life instead of being forced to scramble all night while she tried to sleep. 5 things to do tonight. 1. Do the PIT test right now. Know your grade. Write it down. 2. Cut one source of hidden sodium tomorrow. The biggest hitter for most people is cheese, cured meat, or canned soup. Pick the one you eat most and replace it for 2 weeks. 3. Before dinner tonight, take a 5-minute walk, not later, before dinner. 4. 90 minutes before bed, legs up the wall for 15 minutes. Deep belly breathing for 3 of those minutes. 10 upward strokes on each calf when you get up. 5. Tomorrow morning, 30 ankle pumps before your feet hit the floor. Do this for 2 weeks. Retest the PIT test. You'll be startled by the change. One last thing. I want to know 2 things before you go. How old are you? Write your age in the comments. The age of this audience genuinely shapes which topics I prioritize next. If most of you are 65, the next video looks different than if most of you are 75. And second, where are you watching from? Which city, which state, which country? Leave it in the comments. I want to see how far this conversation is reaching because it helps me understand who needs this kind of information most. And if someone you love has ankles that swell by evening, send them this video. They have almost certainly been told it's their heart, and they've almost certainly been handed a pill that doesn't address the real mechanism. You may give them the explanation nobody bothered to give them. Your ankles are not betraying you. They're a drainage system that stopped getting the signals it needed to run. Give it 5 minutes a day, and the difference is not subtle. It's the kind of change you see in the mirror, feel in your shoes, and notice the first morning you wake up without needing to press your thumb into your calf to check if the swelling went down. Nobody at your next doctor's appointment is going to walk you through this. There's no time. There's no reimbursement. The system waits until you're dependent on pills that barely work and tests that cost thousands. But now you know exactly what to do, starting tonight, for free, using nothing but your own body and 5 minutes of intentional movement. I'm Dr. Hartmann. Your health is your responsibility, but you don't have to figure it out alone.